Okay, I'll knock on the patient's door. They'll let me enter. I do my hand hygiene. Good afternoon. My name is Claudia. I'm going to be your student nurse today. And today we're going to be going over the lung and thorax assessment. So first I'm going to start off by asking you 2 questions. First question, are you experiencing any shortness of breath right now?
No.
Have you ever experienced any shortness of breath?
No.
Great. My next question, are you having any chest pain while you're breathing?
No.
Great. All right, so for the next part of my assessment, we're going to go over the inspection portion. So I'm just going to inspect the overall appearance of the chest. First, we'll look at respirations. If I watch my patient's chest, I can see that it's rising normally. He's not breathing with any difficulty. If I count for a full minute, I can see that my patient is at 18 breaths a minute. The pattern is regular and even. I can tell that my patient has no obvious signs of any bulging or retractions in the intercostal area. There's no accessory muscle use. I can see that my patient is sitting upright and leaning forward slightly while he's breathing. The chest expansion looks symmetrical while he's breathing. My patient's skin is nice and pink. While I'm looking at it, I can tell that there's no signs of any pylor or cyanosis. I can also tell that my anterior-posterior ratio to my lateral ratio is 2:1, so that's great. The second part of the assessment, we're going to go on to the palpation portion. So first I'm going to start off with the anterior portion. We're just going to palpate here. We're going to be checking for any lumps and bumps. We're going to be checking for any tenderness. I'm going to also palpate the lateral sides of my patient. Again, I'm checking for lumps, bumps, any tenderness. I'm also checking the skin color, looking for any abnormalities. Then I'm going to go over and palpate the posterior side. And again, checking for any abnormalities, making sure the skin color is nice and pink. After that, I am also going to look at my patient's posterior side of the back, if you can just turn around so that we can look at the posterior side. I'm going to make sure that the chest is expanding symmetrically. So how I do that, I'm going to take my hands and I'm going to kind of cup the backside to where my tips of my thumbs are touching. And when my patient breathes in and out, I want to make sure that my fingers are slightly moving in and out equally. So that is perfect. My patient can turn back around. So moving on, we're going to go over our auscultation part now. So I'm going to grab my stethoscope. I'm going to clean off the diaphragm of my stethoscope, and I'm going to ask my patient to breathe in through his mouth a little bit deeper than normal. First, I'm going to auscultate over the trachea here, and I'm going to be auscultating side to side, and I'm going to be listening for a full breath sound on each side. And on the front, we're going to be listening to our 10 oscillatory fields. So I want to make sure I get all of those. Then I'm going to go over to my left side, and I'm going to auscultate my 2 left lobes on the left side. Then I'm going to auscultate my 3 lobes on the right side. And the ones on the right side, you kind of auscultate in like a triangle formation. And then lastly, I'm going to auscultate the posterior side. And here we have our 9 fields of auscultation. And we want to be closer to the spine so that we're away from the scapula so that we can hear better breath sounds. And again, we're going side to side. We're listening for a full breath sound. And we want to go underneath the clothing so we hear everything correctly. And what we hear over the trachea, we hear our bronchial sounds. Over here, like in between our scapula, we hear our bronchovesicular sounds, and in our peripheral field right here, and in the back right here, we hear our vesicular sounds. And that is the end of my thorax and lung assessment. Thank you for watching.